Assalamu alaikum, everyone. Name is Murtaza Khwaja. I'm the Legal and Policy Director here at CARE Georgia. Thank you for joining us for this webinar, Serving the Most Vulnerable in a Time of COVID-19. I'm very honored and pleased to be joined with three amazing stalwarts of the Atlanta community. And I'll come to introduce them in a moment, but I do want to touch upon where we are right now in a state of COVID. There's been a lack of leadership that we've seen, not just at the state level, but also at the national level, where our leadership, unfortunately, and our elected officials have not been taking this pandemic as seriously as it warrants. Because of that, we've seen those who are most marginalized and those who are most at risk be put at further risk. Particularly in those groups, there are immigrants, there's undocumented immigrants, and there are refugees that are living here. These people have been left out of the conversation for receiving resources, receiving aid. And in lieu of our elected officials showing the type of leadership in protecting these communities, we've had to look and we've had to stand upon the shoulders of those within the community, our community leaders, both here at the state and at the national level. Alhamdulillah, I'm joined with three of those leaders with me today. I am joined with Muhammad Anamullah, who is the founder of the Glitter of Hope organization, Dr. Gulshan Harji, who's an internist and also the founder of Clarkston Community Health Center, and Dr. Mona Megahead, who is an Atlanta area pediatrician and vice president of Georgians for Syrian Refugees. Alhamdulillah, thank you all for joining us. And thank you for the viewers for tuning into this very important discussion. We're lucky to have such great philanthropists and such great leaders within our community. And I look forward to having a conversation about what their organizations have seen, what changes have happened since COVID-19, and what work their own organizations are doing in this time. So I want to welcome our panelists at this time. How are all of you doing? How are all of you managing COVID at this time? I know it's a difficult time for everyone. Social distancing has been tough, so I'd love to hear how you've been handling it so far.
Well, assalamu alaikum. This is Muhammad Anamullah from the Glitter of Hope Foundation. And I especially like to thank CARE Georgia for giving us this opportunity. Indeed, very difficult times. Social distancing is only one of the elements of being difficult times. There are so many challenging things that we are seeing every day in our own lives and the lives of the other people. So what you stated is absolutely correct.
Thank you for joining us, Uncle. Dr. Mona?
It's definitely been I have 3 young kids, so we've had to transition to cyber school. That's been pretty fun. So, definitely a change for sure.
I know that can be tough. Dr. Harji, thank you for joining us. I believe you're on mute.
I thank you for this great opportunity. I'm not a one to stay at home, so this is being sort of like being in prison. But nonetheless, social distancing has not worked very well for me. I don't like it, but it's something we all have to do. Wearing masks, and my own sister lives in Atlanta, and not being able to visit her, but only being able to FaceTime has been quite difficult. But we're going to all do what we have to do in order to keep ourselves safe and healthy, and bearing in mind that wearing masks is an important responsibility, because in doing so, we are actually protecting other people. Thank you.
Absolutely. And I think, Dr. Harji, that's what we've seen sort of happen through in all our lives, is that social distancing has been very tough, but we understand as community leaders, that there's certain measures we have to take to protect those within our community. And leaders such as you and Nam Uncle and Dr. Mona, all three of you are really showing the light and showing us how we can escape from these dark times. So I want to move on into talking a little bit more about the organizations you're a part of, what work they're doing with some of the most marginalized and some of the most at-risk communities. Muhammad Anamullah is the founder of the Glitter of Hope organization, which is a not-for-profit 501c3. It It's devoted to addressing the basic needs of orphan children from refugee camps in Africa and Asia. Claire, Georgia has partnered with Glitter of Hope and these other organizations as well at several points. Dr. Gulshan Harji is the founder of the Clarkston Community Health Center, which is also a nonprofit 501c3 organization that provides patient-centered medical home for low-income residents of the city of Clarkston and surrounding communities. And Dr. Mona is an Atlanta area pediatrician and vice president of Georgians for Syrian Refugees. The Syrian Community Network, which Georgia for Syrian Refugees is a part of, is a 501c3 refugee and immigrant support organization that builds community and serves families by addressing their evolving needs. Dr. Mona has been featured as a Health Hero of the Year in Oprah's O Magazine in 2018 and received CARE Georgia's very own Community Service Award in 2020. And she was also featured for the ISB, the Islamic Speakers Bureau of Atlanta, for Women's History Month in March of 2020. So we're very honored to have all three of these incredible leaders here and stalwarts of the Atlanta community. So Dr. Mona, I'm going to start off, or actually, Namak, I'm going to start off with you and Glitter of Hope. Can you give us a little, and our viewers, a little bit more information about the Glitter of Hope organization and what work you've been doing in this time of pandemic?
Yeah, but first of all, it's perfectly okay to call me Inam Uncle. Okay, and it's an honor. Okay, so don't hesitate. I thought it might be a good idea to start with a little bit of the foundation of the organization. I have 3-4 charts to share, and that will summarize pretty much what we are doing and what we have been doing. And many of your viewers may not be aware of us, so I thought we'll give you a little background first, and then we can go into the COVID thing. So let me share my screen. And okay, so this is our the ongoing projects. As Murtaza mentioned earlier, that the organization was established 11 years ago, and we have been in the field since then, very actively involved in the community. Initial focus was just orphans and single mothers in the refugee community. So currently we are taking care of 27 orphans, that's single moms. But since we started our programs, the orphan program that we have, total orphans that we have supported so far is 110. Many have graduated, they have grown, they have become professionals themselves. They are supporting other people right now, and some we have successfully migrated or shifted to other states where they have more benefits than what Georgia can offer them. We support 3 after-school programs, totaling 350 children every month, 12 months a year. That's a big expense for us, and it's very much required because when the children migrate, come from the refugee camps, they have no idea about education, and a 14-year-old kid is put into a 7th grade or 8th grade in a DeKalb school system, and it's very difficult for that child to cope up. So we provide this support after school programs so they can catch up into their school and continue. We also sponsor 33 children in Islamic schools. That's also a big expense. We have a number of Islamic schools now operating in the city. And we select only orphans or families that are in extreme need or the kids who are doing really good in school and they need better educational institutes. So we support 33 of them so far. We have donated 41 cars since we started this year alone, 10 cars, mostly to single moms so they can be on their own feet and start working. We do a carnival at least once a year. We prefer to do twice a year, in which 400 or so refugee kids participate with all sorts of fun activities. Every year when the kids go back to school in July or August timeframe, we distribute about 300 school bags, joggers, and supplies. We take care of the need of about 200 people or so every month as far as food is concerned. People miss their applications for food stamps, elderly, sick people. So that's our normal average, 200 a month, every month. At least 2 janazas a month we support, where people can afford, the families can afford to pay for the janazas. These are our major ongoing projects. There are multiple other things that we do or get involved with. besides refugees also, but these are the major ones that I just wanted to highlight. I'm going to go to the next chart. So we serve all, Muslims or non-Muslims alike, because we believe that the Prophet Muhammad, peace be upon him, was rahmatul lil alameen, not rahmatul lil muslimin only. So whoever is in need, we try our best to take care of them. Our 70% of our budget goes towards refugee community. It used to be 100% 10 years ago, but there are other people besides refugees in the community, and primarily the Muslim community and non-Muslim community, where funds are needed. People are in extreme situation, and we definitely jump in if we can to help them out. Our biggest claim to fame is that 100% of what is collected goes to the needy. We have no overhead, no expense, and that is very much appreciated by many people. Going to the next chart. So now the COVID related, since this whole thing started 2.5 months ago or so, currently we are serving cooked and uncooked food combined every day, 500 people. So let me repeat, 500 people every day we are serving food, cooked and uncooked combined. The volunteers are active in the field. We have prepaid grocery stores, 4 grocery stores in the area where people can go and get their groceries if they are in need. And we have partnered with there's a large charity called Kitchen something, I forgot the name. They provide us 50 to 60 dinners every day that we deliver to homeless in Tri-City area, Stone Mountain, Decatur, and Clarkston, 7 days a week. In partnership with Musa, which is another fantastic organization in the city called Muslims of USA, we have distributed thousands of masks and gloves to the medical institutes and emergency organizations like police and all that. Additional rent payment for this month that we paid for was for 30 additional families. So remember, 27 or so families, 27 orphans, that's 11 families in the beginning, and then additional 30 families. So we are currently paying rent every month to 41 families, and we anticipate that to going to 50 and 60 next month. This month alone for 41 families, it was an expense of about $37,000 a month. So, so we are doing fundraising and trying to support all these. A lot of people are losing jobs. As you know, we are getting multiple calls every day, people asking that they lost their jobs, they were working hard before, and they cannot pay any rent anymore. And this is the last chart. What's our next focus is that we have a lot of calls and the requests from single moms saying that they want to stand on their own feet. They want to be able to make money. They don't want to go and work in retail environment. They have their own business ideas. Some are fantastic ideas, and they are looking for microloans. So inshallah, we are trying to focus on that. The second focus is going to be adult education, especially for women, for basic English, basic mathematics, and basic how to live in this country type seminars. We are looking for new volunteers. We are looking for additional funds. Here's our website at the bottom, glitterofhope.org. I know it's not a fundraising event, it's a care platform, but I just wanted to mention that especially for these microloans for single moms, we have currently 15 or 17 women who have participated or called in with their applications. So that is something that we are seriously looking into. So this is in a nutshell what we do and what we have been doing. Thanks a lot.
Well, thank you for that presentation and the detail that went into there. And I think it's absolutely okay also we want our viewers to know about the good work that all 3 of these organizations are doing. We want you to donate and support them, because without the community support, we wouldn't be able to do the great work that these groups are able to do. So they've been able to do some really great stuff so far, but inshallah, with your support, they'll be able to do a lot more in the future. So I did want to ask a couple of follow-up questions too, because in the Clarkston community, I think it's important to recognize, while there is a very large refugee population and sort of known for that, there are other members there as well. But during this time of COVID, are you seeing anyone in particular being affected more? Is it the refugee population that's being affected more? Is it lower income families that are being affected more? Families with a single parent?
So thank you for this great opportunity and to be on a panel of such distinguished people with such amazing accomplishments. Thank you. Well, in Clarkston particularly, there are several families that live in multi-generational homes, so that there are elderly, young children, and then the working parents. And when you're in congested families, it just takes one exposure and everybody else is exposed. Their working situation can be very tragic and very challenging because many of them do day jobs that are hourly wage. So they are farmers or they go to poultry farms or many such jobs that require them to be shuttled in small buses so that there is not enough space between passengers, and that again exposes them. In working situations, they may be in meat and poultry where there is not enough space between employees. So these are some of the challenges. Plus, their basic health is perhaps already compromised, being that they are refugees and probably don't have access to healthcare. Plus, they already have high risk of diabetes, obesity, hyperlipidemia, heart disease, asthma, maybe some are smokers. So their basic health is already compromised. So that puts them in high risk category. And so there are many reasons for people who live in Clarkston, particularly the refugees and those who are marginalized, to be at risk for COVID. Perhaps also not having masks would also add to the problem. But hopefully Clarkston Community Health Center is there and accessible so that we can provide what is missing or fill in the gaps in their lives. And certainly our collaboration with Glitter of Hope to provide food and resources once we find patients that are COVID positive. We immediately self-quarantine them, provide masks, and make sure that their medications are delivered to them. And then Inam uncle, of course, your Inam uncle, but my brother Inam, make sure that they all get at least 2 weeks of warm meals and additional groceries. It's pretty amazing how he can manage all that. But in terms of post-COVID has presented several challenges in that we can't see patients in person, so that we have transitioned to telemedicine, so that it behooves us to reach out to every patient that wants us to give them counseling or care, that we give them access to our services. Now, if they don't have internet, that poses a challenge for being able to get on Skype or secure Facebook or telemedicine. But the interesting thing is all refugees and immigrants, migrants somehow manage to get a cell phone. So we are able to reach them through phone. And so we can text them, we can call them, and we can get on a secure line to discuss their healthcare, so that they can give us their blood pressure readings, blood sugar readings, give us their prescriptions so we can help them tweak them. And if they give us a pharmacy number, we can call them and give them refills. So this is how we've managed post-COVID. Also, we had an insulin drive where our existing patients who are insulin dependent were able to pick up their insulin supplies through a drive-through mechanism where they bring their insulin logs, and we were able to give them their 3-month supply. We are also soon to launch our point of care lab through drive-through, where patients may be able to stick their arm out of their car window and be able to get a blood test and be able to be called later and have their prescriptions tweaked. So we're trying to adjust and provide all this. And of course, we have now established a free testing site on weekends for free COVID testing on Saturdays. So I can give you details as the conversation carries on. Thank you.
Absolutely, Dr. Harji. And I think you touched upon a few things that it's really important to note. One of being that there's a lot of overlap between the work that these organizations are doing and the type of collaboration we've seen among your organizations is something that I think is very inspiring and something that is really beneficial in the long run for the community. The other thing you mentioned is about sort of the essential workers and why some refugees might be more particularly at risk is because they are a lot of times employed in these essential working positions, which really why it sort of baffles me even more that when we do have talk about resources or aid being given to the entire nation in the form of stimulus checks or unemployment insurance, these workers are the ones being ignored. I mean, if they're already more at risk and they're are infected, then that's a threat to the entire community. That's endangering the entire community. So I think any type of policies we see later on, both at the state level and national level, really needs to take that into account, that if we're not protecting our entire community, particularly those essential workers, which a lot of them are made up of refugees or immigrants, then we're doing a disservice to the entire community and we're not going to be able to overcome this pandemic in an effective way.
Absolutely, absolutely.
And so
I have a quick comment on that.
Absolutely.
People don't realize, and you're absolutely right. You know, majority of the refugee community that's actually working very hard, 8 to 10 hours a day in these chicken processing plants and other locations have been working as contractors, not employees. So there is funding available or had available to be given out through PPE programs to employees, people who are getting W-2s, but people who are considered contractors, you know, there is nothing defined for them how to go and apply for funding. So there's a large population within the refugee community that is not benefiting with whatever is available through the government for them.
Absolutely. Dr. Harji, we're going to come back to you to talk about the work that the Clarkson Community Health Center is doing, but I'm going to shift now to Dr. Mona. I know you have a presentation prepared for us as well, so the floor is yours.
Okay, thank you. So I'm definitely very humbled to be amongst such pillars in the community, really true role models. And, you know, we're kind of a smaller, younger organization. And so I look up to Glitter of Hope and, you know, these massive, amazing organizations for guidance. I did prepare just a small slideshow that kind of just details what we've done and who we are. So, you know, we are a chapter of an organization that's based in Chicago called Syrian Community Network. And our sole focus is really to supplement efforts that already exist in helping refugees adjust to their new home. Our chapter is a younger chapter. We started in the summer of 2017, and we've since accumulated about 160 refugee families of various ethnicities and denominations. And last year, we were actually recognized by and added to the Coalition of Refugee Services, which is a group of 18 to 20 different local organizations in the Metro Atlanta area. Our mission is a support organization that really builds community and serves families by addressing their evolving needs. Some of the highlights that we've been able to accomplish since our inception, you know, the first is several programs, one of which is our financial aid program. We've spent over $140,000 in rental aid, $30,000 in car purchases and repairs, and over $7,000 in emergency bill pay. We've also tried to empower, you know, our new neighbors by offering several different workshops in conjunction with local organizations. So the Healthy Family, for example, we partnered with North Family Services. We did a cultural sensitivity and awareness workshop. We actually had Dr. Hival Kelly, who is known in the community, come and, you know, talk to these refugees about his history and how he came as a refugee in the 90s, and now he's a physician. We also had a workshop on workplace ethics. We do have one employee who we just made full-time, and she really does the brunt of the work. She does a lot of case management, so she helps families get health insurance, file for disability insurance, reapply for food stamps. She helps them with employment, and she's helped with trying to apply for unemployment benefits over the last couple of months. Many of our families are Arabic speaking, so we do offer translation services. And, you know, there are special circumstances, which could be joyous ones and ones that, you know, are difficult. We've made funeral arrangements for 4 families since 2017 and provided psychosocial education and help to the families going through difficult times. We've also, during this pandemic, have really kind of stepped it up and made sure that our families were completely aware of what was going on in the news. We translated several medical documents to Arabic. We partnered with an organization called Cornerstone Counseling based in New Jersey to offer psychological support. We've also done several drives, including a backpack drive where we were able to give 250 brand new backpacks with new supplies to some of our families. We've done several hygiene drives, blanket drives, food drives, and toy drives. One of the things we've also tried to do, again, as you know, we are all pretty new to this, is work with different agencies and local nonprofits, learn from them, and work in conjunction with them to help as many families as possible. We've provided over 100 laptops and PCs to families. And one of the things that I really like is the Amazon wish list. Basically, every family that comes new, we provide a brand new wish list of items. It's kind of like a wedding registry, if you will, where they get brand new, you know, items that welcome them to the United States. These are just, you know, some of the pictures where, you know, this is our food drive. We have been proud recipients of the Islamic Relief food drive since 2017. And typically we go out, we're with the families, we involve our own kids. You know, you could see my kids and Fatima's kids there. This year's been a little different because of the social distancing, but we have provided gift cards in lieu of the boxes. These are some of the toy drives that we've done for both Eids, so the festivity after Ramadan and the festivity before Hajj. And we've partnered with Helping the Community, as well as several individual community members that wanted to help with the project. One of the workshops that I really like is the Mommy and Me workshop, where we educate new moms and existing moms on car seat safety, you know, breastfeeding versus formula feeding, and provide them with some basic necessities. And another thing that we've done is for some families that are going through really trying times, we kind of do a home makeover where we rack up volunteers and really set up a nice apartment for them. And this is some of the wish list items that we typically hand deliver to the families. And lastly, I really want to give a shout out to all these different organizations that we've worked with that have helped us in one way or other. We really wouldn't be where we are without their support. So we really appreciate all of them. And that's it.
That's amazing, again, to see that collaboration between all these groups, which I know is not only necessary for the community, but also allows our efforts to be a little bit more reflective of the community as well. So that's, I think, it's something that's incredibly important. I think we're very lucky to have you, Dr. Mona, as a practicing pediatrician, and Dr. Harji, having practiced medicine for 2 decades. And then also with this input of Glitter of Hope and also the work that you do, Dr. Mona, we sort of see this intersection between we're in this time of a pandemic, but a lot of the services you just talked about aren't necessarily medical services, but they have an impact on the well-being and the health of the community. So I'd love to hear a little bit of how this improves a community's health and well-being. And Dr. Harji, if you want to come in at any point too to provide any information, then we're going to go to your presentation next. So just briefly on how working on services outside of just providing healthcare actually is beneficial in this time of a pandemic specifically, and how it does provide some level of safety for those in the community.
Sure. I mean, I can start with that. So over the last couple of months, I mean, it's been unprecedented for everyone, really. and a true eye-opener for me on a personal level, because you can have the best job and find yourself unemployed. Local pediatricians, and actually pediatricians nationally, are seeing that their numbers are reduced by more than half, because people are just either not getting sick, right, because kids aren't in school, or they're too afraid to come to their doctors. So one of the things that I've tried to do specifically with the refugee community is really push them, if they have a check, or if they have a visit where they're going to get vaccines, to go to their doctor social distancing, because the last thing we want is a preventable pandemic, right? So measles or polio. We've also talked a lot about the fact that they need to continue care of their own health. Many of our refugees, as Dr. Harji mentioned, are diabetic, have high cholesterol, high blood pressure, and sometimes they're, a little negligent medications, as we all are. Sometimes they cannot afford their medications. And right now, especially in this time where we have this news amongst us, we need to try to make sure that we are taking every precaution and taking care of ourselves, and making sure that we're taking all our medications as long as possible if we were to get sick with COVID. One of the other, many of the families that we work with smoke. And so I kind of took it as an opportunity to really encourage them to stop smoking. Now is a great time, especially with the month of Ramadan, they're fasting anyway. And then, putting medicine aside, many of our families have 1 or 2 laptops at the most. So cyberschooling, which I touched on early, is a true challenge and has posed a challenge for our families. You're talking about 7 to 10 children in a 3-bedroom apartment trying to do e-learning with 2 or 3 laptops. So, we've really had to intervene, be the liaison between these families and this, try to find alternate methods of education so that they don't lose a quarter of the year. So it's definitely been interesting. And as Brother Anamala mentioned, we've had an increase in financial aid requests. Over the last 2 months, we've had over 60 families apply for financial aid, where typically we have about 10. And of course, being a smaller organization, we could only help so much. So we've been able to help 35 of those families. And then working with our collaboration with Glitter of Hope and several local mosques and other local organizations, we've been able to make sure that the rest were taken care of. But this isn't a short-term problem. We are going to see long-term consequences because of this pandemic. And so, just putting in a pitch, just like Brother Anamala, any fundraising that we can do, every little bit counts. And it will go to these families and it will help them during this time of crisis.
Well, let me contribute. First thing towards what you just said, Dr. Mona, is that the lack of computers in those households. We just received a donation of 10 desktop computers with their monitors and everything. And why don't we give you as a gift to your organization to so that you can distribute that within the families that you are talking about.
Thank you.
So that's a wonderful example of networking, collaboration with each other. And it was donated by Bulldog Insurance, actually our chairman of Glitter of Hope, Asfar Haq. And so we will give all those to you. And it just came in a few minutes ago before the conference call. So inshallah, we'll make it a delivery to you, and then you can distribute to those needy families.
Beautiful. That's beautiful. So as far as Clarkston Community Health Center is concerned, keeping us busy with 7 days a week telemedicine, all our drive-through clinics, and COVID testing on weekends has kept us plenty busy. But besides that, we've been able to provide care packages for patients who come through the drive-through with food items that are, if they are diabetic, to make them diabetes-friendly food items, and for women's hygiene products. And so we've also tried to create movies and videos, and of course, information about COVID in several different languages. And one of our volunteers, who's a student at Rollins School of Public Health, actually created a document about how to eat right during Ramadan. So we're trying to be creative and trying to provide different kinds of services beyond healthcare. We realized that many of our patients have suddenly been calling that their green cards have expired. And so they need help with immigration, and they need physicals for immigration. And of course, I was a civil surgeon when I practiced medicine in my private practice, but do not have that portfolio while I operate the free clinic. So we are in need of individuals who can provide these type of services to our refugee community in the immigration field. So we would like to make that appeal while we're on this webinar. Thank you.
Absolutely. No, inshallah, we'll be able to hopefully find some people who can, facilitate at least in a consultation role, even if they can't fully take on the role at this point of representing those people. So I want to move on to Dr. Harji, the Clarkson Community Health Center. So I know that the center focuses on being a patient-centered home, medical home for low-income families in the community. What has the role, and you've touched upon this already in the beginning, but how has the role of the center sort of expanded, or has it been, has it have to sort of been dwindled a little bit during COVID? Are you seeing any types of, we're hearing about lack of resources in a lot of other medical facilities. That's something that the center is dealing with as well. We want to hear about, from a medical perspective and from a healthcare perspective, what is the impact we're seeing on the Clarkson community during this time of pandemic?
Well, that's a loaded question, a number of questions. So in order to answer that, I'll have to spend just a couple of minutes to give you the history of what Clarkson Community Health Center is, where we were pre-COVID, and so you can understand where we are during the COVID pandemic. So my co-founder, who also happens to be brother Inam's older brother, Dr. Saeed Raiz, who is highly intelligent gentleman. He's a scientist, he's a pharmacist, he's a businessman. He is such a multi-talented man. He came to me one day and he said, how about we start a free clinic? And that was just something that had been on my mind all the time. And it was great to hear that there was a partner that wants to be in that field. So that was an amazing offer that he wanted me to help him create this Clarkson Community Health Center. So in my private practice, which I owned and operated for 30 years, we spoke 15 languages. So I was already familiar with the immigrant and refugee community. What I noticed was when people come to this country, they get 6 months or 9 months of Medicaid. And then unless they are gainfully employed full-time, they really have no health insurance. And so what do you do? And I was able to some degree, be able to help these people, but the volume of patients got so large that Dr. Saeed Raiz's offer came so in such a timely manner that 7 years ago, we established the Clarkson Community Health Center. We obtained the 501c. It took us 2 years to put the board together, get the 501c, and find the space. Clarkston is a 1 square mile city. It's landlocked. There are 60 languages spoken. There are people from 150 countries in Clarkston, and there is not much available. So we got into this situation where we have a business space that we slowly converted into a medical office. So we have converted office space where there are 2 patients per room. And so now with the COVID crisis, you can imagine what it's going to be like. On a Sunday, we could go through 100 visits. And so now with the COVID crisis, you can imagine that in 2,000 square feet, where would we be able to handle 100 patient visits, plus the volunteers, plus the physician providers? So we are going to be challenged moving forward. So even when things are relaxed, it's going to be an interesting situation to be able to see the volume of patients, the complexity of the patient's needs. How are we going to accommodate that? And so we are going to be challenged. But while we're on the subject, we also already were on a capital campaign where we have an offer on a piece of property in just outside Clarkston that we intend to, once this pandemic simmers down, to consider start building. So the actual full ask is 1.4 million. We're already halfway into the capital campaign. Alhamdulillah, the community has been very responsive. Many foundations have stepped up to the plate. So we are halfway through our campaign. But during the pandemic, while we are working on the COVID crisis, and while we are on free testing drives, several foundations have stepped up, and we are receiving small grants so that we are able to carry out these drives on weekends. The DeKalb Board of Health has collaborated with us and providing us free testing kits. We're getting some donations of PPEs. So we are paying small stipends to the frontline volunteers because they are risking their lives, swabbing patients, standing outside in the hot weather. And so we feel like we can afford to pay them a small stipend. So that is our intention for the next 12 weeks, is to provide free COVID testing. And hopefully, depending on how the state of Georgia is handling the crisis, we may offer it beyond 12 weeks.
Alhamdulillah, that's great. And we're getting some comments and questions both on our YouTube link and on our Facebook. So please, for our viewers, we're going to have a Q&A session. So please send those in. Dr. Harji, you're getting some fan mail on here as well.
Oh, what are they saying?
We have a comment, love Dr. Gulshan Harji, just an amazing human being.
Oh, I'm going to take a break and just cry for a minute and come back. Oh, that is so beautiful. Thank you.
No, alhamdulillah, I think all three of you are doing such amazing work. And one of the things, Dr. Harji, that you mentioned was when refugees come over, they may get Medicare for 9 months and then it's tied to their employer. And I think this is an important point for all of us to make at this point, that we're living in a country where medical health insurance has been tied to one's employer for, I don't know, the last how many decades. And in a situation where there's a pandemic, I think this sort of portrays why this is such a problem, because a lot of people are losing their jobs. And if they're losing their jobs, they're losing their healthcare. And particularly when there's which is problematic at any point, but particularly when there's a medical health crisis like a global pandemic, it's really catastrophic. So it's something that, from a policy standpoint, CARE has been pushing for there to be some form of health insurance that's not tied just to your employer, but is easily accessible to those most marginalized groups and affordable for them as well. So with that being said, I want to open this up to all the panelists. I know all three groups do a majority, if not all their work in the Clarkston community. So what drew all of you to Clarkston to start off with? What is it about Clarkston that you felt your organization could serve their community better than perhaps any other organization or any other community outside of Clarkston?
Well, let me start probably because we started 11 years ago. And by the way, Dr. Gulshan Harji, the comment that Murtaza just announced, I echo that comment. Okay, so you are you are the biggest symbol the city has for us to take on these tasks, and major blessing for us. So I hope you stay healthy and stay with us. And now going back to not many people know a lot of things about refugees, a lot of misconceptions in our community. For example, the airline ticket that the refugees have to, that they use to come and fly to the US, it's actually a loan to them, the value of it from the US government. So after 6 months of employment, they're supposed to pay that money back to the government. If I'm not mistaken, it's about $2,600 per person that they get when they come here. So a family of 5 will get about maybe $12,000, but they don't get that. The hosting organization gets that. And the hosting organization, there are 5 or 6 people who have license in Atlanta, large entities. And they basically spend that to pay for their apartment rental for a month or 2, groceries, and driving them around and getting some furniture and all that. So basically all that fund expires on an average we have seen in 3 to 4 months. And they are supposed to be on their own after that. There is no financial help available from any government entity, in 3 to 4 months time frame. And then they're supposed to pay back the loan that was the airline cost that they used to come to the US. These are a couple of examples that people don't know about. People think that when refugees come in, they're covered for life in the US, and that's not the case. It's a very short period of time that they have to stand on their own feet. And just imagine a single mother coming from a refugee camp, living in a refugee camp for 10 or 11 years, not being able to speak a single word of English language, with 3 kids or 4 kids, and how is she supposed to be on her feet in 3 to 4 months? Now, you said how it all started for us 11 years ago. I was driving on Indian Creek Drive, I believe, where Masjid al-Mumineen is. And after that, we saw a family with 1 mother and 3 children under a little bridge and settling down in there. And we stopped to ask the question, and she was evicted after 4 months of coming into the US, and she hardly spoke any language. So we realized that families, especially single moms and their children, are most vulnerable. So we decided to investigate how many such families exist. And at that time, there were 13 families. And so we collectively, some of our friends got together, some volunteers got together and started taking care of them. Otherwise, they would all go on the street and suffer. So that's how it all started for us with those 13 families, and basically grew from there on.
I wanted to sort of echo what Brother Anamullah said. There's a huge misconception, and I myself was completely ignorant of what our refugees go through when they actually make the transition. First of all, it takes 2 years for them from the time they apply for resettlement to actually get resettled. When they come here, they're resettled through a refugee resettlement agency, and they're given about 3 to 4 months of aid. And this includes an apartment, very basic furniture. So a mattress, which is new, 1 utensil per family member. So 1 spoon per family member, 1 dish per family member. They're shown, how to buy their groceries. They're given some basic classes, which of course, when you're new to the United States and your mind is, going 1,000 miles per minute, you're not really focusing on everything that's being taught to you in those few classes. After that 3 to 4 months, they're supposed to be on their own. Studies have shown that it takes about 5 years to learn the English language. Majority of our families do not have a college education. Many of the ones we serve actually have a middle school education, and some are completely illiterate in their native tongue. So to add on a completely different language in a foreign land and with different policies and different is quite taxing. I myself, I got into refugee work actually in New Jersey back in 2015 when I had heard a lot about the Syrian crisis and I wanted to help and wasn't sure how to do that. And then I saw an event at a mosque that was hosted by a young, a community-based organization that was started actually by a 21-year-old girl who went to Turkey for the summer and was just touched by what she saw, that she decided to start this nonprofit. And I met, 14 of the refugee families exchanged numbers, visited them with my family, and just spent, an entire day crying, listening to their stories, seeing how they're living, meeting their children. And I just felt like, it's great that we're bringing them here, and the resettlement agencies are doing a good job with this within the scope of what they're supposed to do, but then what? So when we moved here, I actually knew Ahmed Sabah from before, and he had kind of started this Georgians for Syrian refugees. And I guess he was a little familiar with what I've been doing in New Jersey, that he just pulled me in. And since then, I can't let go. Majority of our families are in Clarkston, but we do have some families that are kind of scattered in the metro Atlanta area. We had a couple in Gainesville. We have about 10 in Marietta. We have a few in Tucker and Decatur, Stone Mountain. But the bulk is Clarkston. And I had not known anything about Clarkston prior to getting involved, but you just gravitate towards it. You see people from all walks of life just smiling, engaging you, talking to you. And it's a lovely representation in my mind of what America should be, right? It is based on immigrants, and this is how all of America should be reflected.
Alhamdulillah. And we've got some more fan mail for all three of you, actually. So in Nam Uncle, we have, this gentleman is a hidden jewel. Can't compliment him enough. May Allah, may Almighty bless, protect, and reward. And then Dr. Mona is such a gem in our community. I don't know how she and the SCN Atlanta team do the sheer amount of work that they do, but we are so, so grateful. May Allah preserve and protect her and her team.
Amen.
And then love my young sister, and that's from Amoy Imad.
So Brother Murtaza, if I may just also answer that question.
Yes, please, Dr. Hardy.
So in order for us to understand why I'm in Clarkston, I might want to just give you a little bit of history about me so you'll understand why my passion is Clarkston. So I grew up in Tanzania in a village of about 500 people. We used to get our vaccines through UNICEF. And then high school, I went to the south part of Tanzania, where I had contracted malaria in a very deadly stage, where I thought I was not going to make it. And then when the country was becoming nationalized, my dad decided to send me to Pakistan, where I had typhoid, and again had a severe case of typhoid. A war broke out with India, so I left to go to Iran. And started med school. Midway through med school in Iran, the Shah and his wife went into exile. And so I came to the United States. This was during the Iranian embargo. I applied to 200 med schools all over the world and got one interview with Dr. Louis Sullivan, and entered Morehouse School of Medicine in their charter class, and then transferred on to Emory and graduated and got my residency. And then several years later, my husband was shot and killed. And then I had breast cancer with 5 surgeries, chemotherapy. So putting all that in perspective, that I came to this country and entered a medical school with no formal education in this country is sort of quite a miracle. To have had the opportunity of a great education, speak 6 languages and do primary care, and to be 3 miles away from Clarkston, it seemed like the right thing to do. Being a cancer survivor, being a widow, it all sort of fit together that I was being drawn to Clarkston. And when Dr. Rais asked if I would help him start this, it just fell in place. And knowing that Clarkston is where our refugees and marginalized community, and where I used to be and I grew up, and it just is the right thing to do, giving back to society, paying forward. And it also is in line with our tariqah and our mazhab, is to reach out to the poor, to the sick, to the elderly. And so I can't tell you how fortunate I am to be able to reach out to this community and to be able to share my knowledge and my time and whatever treasure I have with a community that so much needs us. So thank you very much.
Thank you, Dr. Harji. So we're just about out of time, so I'm going to have all of you leave us and leave the community with one positive step that those viewers who are listening in today can take away, or that they can do to help the work or amplify the work that your organizations are doing in Clarkston and in some of the other communities we mentioned. Dr. Harji, do you want to start? And
yes, so at Clarkston Community Health Center, we have several opportunities. One is that our need is for volunteer physicians, volunteer providers, any other volunteers that would like to step up and help us deliver care. We also can use funds. We can always use funds. There are several ways to support us. One is either you can support a special area of the services we deliver, medical, you want to donate to the dental aspect or the specialty or the pharmacy, or the eye services or the women's care or the mammograms and the women's health care. We also have a capital campaign that's going on, so you can go into our website at clarkstonhealth.org and you can donate, and you can also text. So the text, donate by text is HELP, HELP, CCHC uppercase, and it's 44321. Again, the texting is HELP CCHC 44321. And so they can always reach us by phone, by email, or get on our website and contact us. We'd love to show you what we do. Thank you very much. We couldn't survive without the community support because we are totally 100% funded by people and organizations. So thank you very much for making us making it possible for us to go on into our 7th year with 4,500 patients. Thank you.
Thank you, Dr. Harji. And Dr. Mona, do you want to go next? And then we also have a question. So quickly, if we can, if we get through these, then the question is, how can we build a sustainable network that does not depend on one person?
So, as far as volunteers, we can always use volunteers, and, this is a true community grassroots effort. So if you come, regardless of how old you are or what you do for a living or your profession, you come with an idea, we will help you make it happen. Just a couple days ago, I had a Boy Scout that had volunteer hours left, and his parents contacted me and said, what sort of drives are you doing? How can I make sure he gets these hours in? And so I told him, well, we have a toy drive coming up. Why don't you make some goodie bags, make a nice card for the kids and come and help distribute, wearing your mask and your gloves, of course, practicing social distancing. And so, he's working on that right now. We do have a driver's ed program, which I forgot to mention earlier, but through that, we've actually helped 75 women take and have a driver's license. We offer 14 hours of educational behind the wheel learning, and we pay for the test as well. So definitely sponsoring one of those families is great. It costs about $650 to sponsor one client. But yeah, just come to us with an idea. We'll make sure it happens.
Sure. And Amakul from Glitter of Hope.
Sure. We are badly looking for project managers. We have projects within the charity, but we are looking for people who can own these projects. For example, I mentioned earlier that the microfinancing program for single moms. A lot of requests are coming in, but we need someone who can actually own the program, take it and run with it. We have multiple other programs we're looking for project managers. So please do contact, go on the site glitterofhope.org and send us your information. We'll be in contact. And I'm going to combine your other question into my answer is that I think the only reason I'm here today on behalf of Glitter of Hope on this call is because I'm probably the most good looking guy in the board of directors has. Otherwise, the organization is currently running by a phenomenal set of volunteers. It's just absolutely amazing. Yes, I'm the one who took the first initiative along with some of my close friends 11 years ago. But currently, it's all new people actually that's running the show. Aziz Danani, Asfar Haq, Rahim Shah, bunch of other people, youngsters, Murtaza, you are included in it, Shaina Azam, young guys. So we are so proud of you guys. You guys are running the show. So it's not dependent, at least in our case, on any one person. And I'm definitely on the back seat, and all the new guys are running the show. So funds are always needed. That's the biggest thing. So if you guys go on the website, two things I'm requesting. One is definitely to volunteer and tell us your areas of expertise where you can volunteer. Quick two examples I'm gonna, and then I'll shut up. Number one is that, there is a 10th grade student, Akil, who called us, and now he runs a weekly class for our refugee kids and in the Clarkson Library. And so, 15 to 20 kids get together. He helps them out with the homework. His teachers accompany him. And Syrian Haq, she has started the mentorship of a family of 4 kids. She goes there. She's, I think, in the 9th grade. And all of the kids are younger than her, and she walks them through their homework and how to study. So mentorship, one-to-one. If you go and ask refugee families, what we have found out is that more than money, more than food, they ask for our guidance. They ask for our mentorship. They ask for our connections on a regular basis. So that's one area we badly need a project manager who can manage matching non-refugee families with the refugee families. At least once a week basis, they can get together, talk, share their feelings, and solve their issues. Thank you.
Alhamdulillah. Thank you so much, Dr. Mona, Dr. Harji, and Anam Uncle for joining us. CARE Georgia is lucky to have connections with these great stalwarts of the Atlanta community, of the Georgia community. They don't just serve Atlanta Muslims or Georgia Muslims, but the entire community as a whole. Dr. Harji mentioned that, we're going to have to do a part 2, and inshallah, we'd love to have all of you back for another conversation, because these are things that are absolutely needed. On a personal level, I've been involved with Glitter of Hope, but I can speak for all of these organizations and say that they do some amazing work, and it's incredibly needed, particularly in this time. So please, to our viewers, if you can donate, if you have the means, please donate some funds. If not, please volunteer some of your time. As Anam Uncle mentioned, your time and mentorship and guidance is something that is invaluable, and maybe down the road may be worth a lot more than any other type of resources that you might be able to provide. So thank you to all our viewers for joining us. Thank you to the panelists. I'm inspired every day by the work all of you do, and remain, looking up to all of you as leaders in this community. So thank you again, and assalamu alaikum to everyone.
Wa alaikum assalam. Excellent moderation.
Thank you. I appreciate it.
Thank you for having us.
Thank you for joining.